Today, we're breaking down Ticalor, a really powerful medication that's become a frontline defense against heart attacks. We're going to find out exactly how it works and why it's considered such a major leap forward in cardiovascular medicine.
So, here's our game plan. We'll start with a huge problem of heart disease, then get into what's actually going wrong in the body. From there, we'll look at how treatments have evolved, which leads us right to the specific medication. And finally, how doctors are using this amazing tool today.
All right, before we get into the nitty-gritty of the drug itself, it's absolutely crucial to understand the battlefield. We're talking about a global health crisis, and grasping just how big it is, well, that's key to seeing why a medication like Ticalor is such a big deal.
Just look at this number for a second. 19.8 million. It's just staggering. That's how many lives are lost to cardiovascular diseases, or CVD, in just one single year. It is, by a long shot, the leading cause of death on the entire planet.
And to put that into perspective, that number, it's nearly a third of all deaths worldwide. It's this silent epidemic that affects every single country, which is exactly why any new advancement in treatment can have such a massive, massive global impact.
Now, cardiovascular disease is a huge umbrella term. As you can see, it covers a lot of different conditions. But our focus today is going to be right here on this one, acute coronary syndrome, or ACS. This is the category for those sudden, life-threatening emergencies. So, what is actually happening inside the body during one of these ACS events? What's the trigger for this sudden, incredibly dangerous situation? So here's the key thing to get. ACS isn't just one single thing. It's better to think of it as a spectrum of problems, from unstable chest pain all the way to a full-blown heart attack. And they're all caused by a dangerous blockage in the arteries that feed the heart. And this slide, wow, it shows that progression perfectly. See how it starts with just a minimal block, maybe causing some chest pain, but as that blockage gets worse, it can lead to a heart attack, what doctors call an NSTEMI. And in the most severe cases, you get a complete blockage, a STEMI, and that's when the heart muscle actually starts to die. It is truly a race against time. And this right here, this is the villain of our story. This is a thrombus, which is really just the medical name for a blood clot that's formed where it's not supposed to be. It basically acts like a dam, completely cutting off that vital supply of oxygen-rich blood to the heart. Okay, so if a rogue blood clot is the problem, then the solution seems pretty straightforward, right? We have to stop it from forming or growing. And that brings us to the science of antiplatelet therapy.
For decades, these drugs have been the absolute foundation of treatment. Their whole job is to stop platelets. Think of them as your blood's tiny emergency repair crew from getting way too sticky and clumping together to form one of those dangerous blockages.
The fight against clots has been a real journey. It started with something as simple as discovering aspirin's effects. Then, over time, scientists developed smarter drugs, like clopidogrel, that could target a very specific on switch on platelets, called the P2Y12 receptor. And all this progress, all of it, aimed at being more precise with fewer side effects, led directly to Ticalor in 2011.
And that brings us right to Ticalor. It represents a huge step forward on this timeline. But what makes it so different from the drugs that came before it? How does it actually work its magic?
The key difference really is all about control. See, older drugs like clopidogrel, they're kind of like a permanent off switch for the platelet. Once it's off for good. But Ticalor is more like a temporary dimmer switch. Its effect is reversible, and it works much faster. This is a huge advantage. Why? Well, if a patient suddenly needs emergency bypass surgery, doctors can just stop the drug, and the blood's natural ability to clot comes back much more quickly. So think of it like this. Ticalor basically puts a temporary pause on those overeager platelets by latching onto their P2Y12 receptor. It stops them from causing a dangerous traffic jam in the artery. And because that effect is reversible, once the drug wears off, the platelets can get right back to their normal job.
Okay, a new mechanism is great on paper, but does it actually save lives? Does it prevent heart attacks better than the old standard? Let's take a look at the proof, which comes from major clinical trials.
And here's the crucial evidence. Groundbreaking studies, like the one called the Plato trial, gave us the hard data, and the conclusion was powerful. Ticalor didn't just reduce MACE, that stands for major adverse cardiovascular events, things like heart attacks and strokes. It was actually shown to improve overall survival compared to the older drug. That's a huge deal. Then there was another landmark study, the Pegasus trial. This one looked at long-term prevention for patients who had already had a heart attack. And the results? They were crystal clear. A significant 15% drop in the risk of another major event. Now, there was a trade-off, a higher risk of bleeding, but crucially, not the most dangerous, life-threatening types of bleeding. And here's the visual proof from that study. You do not need to be a statistician to see what's happening on this graph. That widening gap you see between the blue Ticalor line and the green placebo line, that represents real heart attacks and strokes that were prevented over 3 years. So, with such strong, compelling evidence from multiple trials, how do the world's top medical experts recommend using this drug in the real world right now? Well, we don't have to guess. We can look directly at the official guidelines from leading cardiology groups, like this table from the European Society of Cardiology. You can think of these documents as the playbooks for heart doctors everywhere. And the most important thing here is that Class I is the highest level of recommendation you can possibly get. It's the gold star. It basically means the evidence is so strong that this should be the standard of care. For patients having an ACS event, Ticalor is an absolute go-to choice for doctors. The journey from simple aspirin to these highly specific reversible drugs, it just shows how incredibly far we've come. But it also points to the future. The next great challenge is to move toward truly personalized medicine, fine-tuning these powerful therapies to get the balance between preventing clots and managing bleeding risk just right for every single patient.